Okay, so with this episode, we finally finish interviewing the last of the co-founders of Nos Fabrica. If you haven't seen the episodes I did with Vitor Pamplona and Avi Burra, go check them out. Nos Fabrica is a very promising and interesting project. I am helping out in whatever way I can. And please, guys, let's help these guys make this reality. I do think the world needs a more decentralized healthcare, not just the United States, but everywhere else. And here Jon Gordon will tell us how he sees how Nostr and Bitcoin can help achieve this. Anyways, I hope you guys enjoy this. And one important thing that stuck out for me is, we got to have more Bitcoin babies. That's going to be essential for this new world order. Anyways, enjoy. So for those just tuning in, welcome to another episode on the Dr. Fernando Morales podcast. Today we have Jon Gordon from Satoshi Health Advisors and recently Nos Fabrica. So Jon, can you please present yourself to people who might not know who you are, and tell us how you got also into Bitcoin and Nostr.
Yeah, thanks so much for having me, Dr. Fernando. Really appreciate it. And it's been great connecting with you and other Bitcoin and Nostr docs out there over the last couple of years. But I'm originally from the Chicagoland area and went into healthcare out of college, helping hospitals and health systems with strategic planning everywhere across the country, focused in whether it was post-mergers and acquisitions, ambulatory strategy, post-acute care, the whole gamut, and really helped me understand the healthcare ecosystem and landscape in the U.S. But the payer side was still very opaque. Despite working in the C-suites of some of these health systems, you'd be surprised to the limited understanding they even have of their own books and their own costs of production, right? And so I went into the insurance side of the business and was working in Medicaid and seeing from the inside several $100 million in losses for a Medicaid plan that was floated from the commercial side, so they didn't really care so much. Although saw a lot of perverse incentives, and continued more down the entrepreneurial path. Got into product management and medical supplies business. We were putting RFID chips and sponges used during surgery to prevent retained objects in the operating room. So got some experience in the hospital, in the trenches. Really appreciate what surgeons and doctors and nurses and techs and everybody's doing with our more the intervention side of healthcare. And during that time, I was doing a double master's in health economics and policy. So also got outside the U.S. bubble, was studying it in London and comparing, contrasting different health systems around the world and understanding the differences and who's paying for healthcare, how that leads to access, coverage, and outcomes, comparing tax-funded models, social health insurance, universal payer, more private systems. And that's really when my Bitcoin journey started in mid-2020. That program was over. The money printing was starting. I was getting married and just started asking the question, what is money? And that really opened my eyes up and realizing that a lot of the fiat economics that I'd been learning in undergrad, although I resonated with the health economics side of things, and was pretty far off base, right? And started studying Austrian economics, understanding Bitcoin. And as we could travel and be nomadic and not have to be physically in Chicago for my kind of fiat job, realized that there was a lot more out there and that no one really, even in the Bitcoin space yet, and this was mid 2021, was necessarily making the connection to healthcare, despite it being a $4.5 trillion a year market now in the US, with a quarter of that being administrative, half of that's waste. And when I went to El Salvador, kind of my own accord, at the first adopting Bitcoin, now they've got another one going on now. I wish I could be down there. In November 2021, realized, wow, this is amazing. Meeting Bitcoiners, hearing these viewpoints, and seeing that I think there's a greenfields approach in the healthcare space. And left the fiat job, traveled a bit, did a yoga teacher training, ran a marathon, and realized I wanted to work at this intersection of healthcare and Bitcoin. And that's what led me to Crowd Health in Austin, which was a great experience, and getting Bitcoiners into an alternative to health insurance and solving one huge pain point, which is how am I going to pay for healthcare in a more peer-to-peer sovereign way? And then identifying and saying, where are the providers now who are going to be accepting Bitcoin, and creating more of a circular economy that we've seen happen in other towns around the world that I visited, whether it's, of course, Bitcoin Beach in El Zonte or Bitcoin Akasi. Proud to say I was their first visitor beginning of 2022 in Muscle Bay, and they've continued to grow and really flourish and get more businesses and merchants onboarded, as well as educate the community on how to use Bitcoin. cutting out those middlemen in healthcare. I mean, there's so many, they're all over the place. And I wanted to go out with Satoshi Health Advisors, helping providers and other healthcare businesses, or really any business, integrate a Bitcoin strategy. I know healthcare well, and think there are a lot of opportunities for certain business models within healthcare that are already operating outside of insurance. They're going direct to consumer to start accepting Bitcoin. And it also sends a message on how you're delivering care, right, as a doctor. And that message of taking personal responsibility for your health, really being that coach for an individual, but knowing that just a pill or something else external, might not solve your issues, but if we can get at the root cause of the problem, what's really causing this inflammation? What is it about, maybe diet and lifestyle that's causing issues? And then finding and being that partner in solving those challenges. And then also having the time to even spend with the patient. In the US system, you have about 7 minutes on average to spend that a primary care doctor spends with their patient every year, right? And
wow,
when you're paying directly for a monthly membership, for example, you obviously have much more time, whether it's for an hour or a few visits a year, and to really for that doctor to get to know you, understand your lifestyle, and how you can really encourage those changes. And so I've really enjoyed working with dentists and direct primary care docs and therapists and even e-bike shops and architects and others that are looking to integrate Bitcoin, knowing what the tools that are out there and helping integrate in their business. And then another area that I think is a huge point of centralization and really frightening aspect of our health is how vulnerable the data is, right? In the US last year, a third of all Americans' healthcare data was hacked. There are huge centralized honeypots of data, whether it be companies like Epic or Cerner, which is now owned by Oracle, or just the big health systems that are dominant in different towns and cities around the US. You don't even own your own data in 22 states. Like you have to go and even buy it from the hospital, and it's
really?
being sold off without your consent. Yeah, it's being sold off without your consent, used in studies. Some of it might be de-identified, but ultimately you're not benefiting from the use of that data in whether it be clinical trials, drug discovery, all the other aspects around health that people and companies are trying to do to attack this issue, which is ultimately chronic disease epidemic in the US that's also now been exported alongside our fiat food and our seed oils and kind of that, those inputs that we know in nutrition that are super important and ultimately leading to a lot of the chronic disease issues that we see. And so kind of organically just doing research and seeing, is anyone looking to use Nostr for healthcare? And found Vitor and connected with Avi as well. And so we're really excited to be starting a company together and try to solve some of these pain points around your health data being owned by others instead of you. And with Nostr giving you the key to your own health data and being able to interact now with a provider in a more sovereign peer-to-peer way, selectively disclosing that information as you see fit. And I think ultimately inspiring or empowering individuals to take responsibility for their health and track certain metrics over time that can help them have better outcomes. And if you go and get your lab test and it's sitting on a PDF file from in your email from 2 years ago, and the next doctor you want to work with or nutritionist says, I want to understand your health, you don't even have the information kind of ready or at your fingertips to share that could really make a difference. And so we want to be able to build tools for individuals to have that ownership of their own data. And everyone interacting can have different interfaces, right? Even with this micro app concept, where Nostr and even the kind of points in healthcare that doctors have to look at their own screens and nurses have to look at their screens. And when you're plugging into the different tools that are out there now, it might be 50 clicks to get to go and do what you need to do from a doctor's, software perspective. What if you could just go to a web page, something simple, and have those inputs right there that you could send to the patient's relay, and now all of a sudden it's there, and we can track it over time and selectively disclose it, right? And it's all naturally encrypted. So I'm really excited to continue to work at this intersection of Bitcoin, health, and Nostr, and trying to decentralize our healthcare system, but also create tools that can be used globally, right? Bitcoin and Nostr are global tools. Anyone with an internet connection can use them. And so while a lot of us have experience in the US healthcare system, we also have done, and personally have done a lot of traveling and experienced healthcare in other countries, and know that there's also a lot of opportunity to bring access to care globally for people that really are in need. And in places where it isn't nearly even remotely close to as expensive as care is in the US, and the ability to talk to a doctor in a certain specialty is something that from a communication standpoint, that Nostr could enable as well. So we're really, really excited to be building and chatting with you, because you've been pretty innovative in your practice as well. And I think bringing a lot of the carnivore lessons and really getting at the root cause of issues. And some docs we've got in the US talking about it, but you haven't seen it really being talked about in Mexico. And so very different healthcare system, of course, but I think probably a lot of the, and we can chat about this, but a lot of the similar challenges when it comes to data being all over the place, very fragmented, and systems that are in place from even electronic perspective, not talking to each other.
Yeah, totally. And centralization seems to be like the root cause of a lot of problems, especially in the United States, well, anywhere in the world, really. And there's a lot of questions that came out of that intro. Fantastic. So
Yeah.
before we get into Nos Fabrica and Satoshi Health Advisors, because that's another company, you own it or you work for it?
Yeah. Yeah. It's my business. It's a consulting practice where I'm helping businesses integrate a Bitcoin strategy. So that came out of really starting last year, and then had a baby, took some time off. I had some more, little thinking and realizing that I think there's something here, and it can be overwhelming once you start to learn about Bitcoin and hear about the tools in the space. And there's a lot of nuance into the ways you can integrate Bitcoin in your business. So I'm there as a partner for usually 2 to 3 month projects, but also have been working with some clients a little bit longer as well, just to help them even message and tell their story and connect to that Bitcoin consumer, or just that Bitcoin individual who is out there getting on zero, wanting to spend their sats, wanting to do value for value. And I think there's so many opportunities in different industries to be a first mover and we're seeing the benefits. And the clients that I've worked with over the last year, whether it was at 25K Bitcoin or 50K Bitcoin, and now we're, approaching 90K, and the message stays the same throughout, but I know that my clients are benefiting from, this appreciation too, and seeing that kind of that longer term vision, and why it's important to add that Bitcoin rail as a payment method, start saving in Bitcoin. And that's it's a huge challenge, because in fiat healthcare, you see this centralization from providers. It's very difficult to stay independent. You need to get bigger and bigger to negotiate contracted rates with insurance companies. And more doctors are getting bought up either by private equity groups or by bigger health systems. And so there are some leaders out there that are independent, that have remained more cash-based. And I think Bitcoin can strengthen those practices and resist the trends of ultimately not being able to find someone you can just pay in cash and have a value for value interaction with, and it's going to be gate kept by your primary care doc in this system, and they're going to give you a referral here. And I mean, you can't even order your own labs here in the US in most states. So you need to be able to get access to a doctor, even if it's telemedicine, can be another game changer as well. But so that's what I've been focused on with Satoshi Health Advisors, and that's where Nos Fabrica is kind of a natural extension out of that, because we have providers, and as I'm working closer with and intimately with practices, can see what are the tools we're using today, what's the healthcare tech software stack that's being developed. There's a huge amount of investment and startups in this space because the challenges are so glaring. But I think ultimately plugging in another API to Epic, and you have these walled gardens, that's not going to solve the issue, and especially of the underlying health challenges that we're facing. So I believe that those values of Bitcoin and Nostr, of decentralization, of empowerment, that sovereign individual who's wanting to put in the work, right? Do that proof of work to say, what is my issue based on my own health, my environment, my lifestyle, where I live, the access to food, sunlight, sleep. What's my situation looking like from a more holistic perspective, and then understanding that there are also many, many other modalities for health and practicing out there. And for me, I studied yoga, and I teach a Kriya yoga that's a lot about releasing negative energy from the body, breath work, moving, and even that I found to be incredibly transformational practice if I'm feeling stuck or stressed or anxious about something coming up, or a relationship, or anything in my life that you can kind of clear that energy. And I think the power of the mind, the power of your breath and the connection with your body is so important. So being able to tune in, to different parts of your body, you can send healing to yourself in a lot of ways, right? And a lot of other modalities in the U.S., like chiropractors or naturopathic doctors, have been boxed out of the traditional healthcare industry. And so I think Bitcoin and Nostr can also help give a voice and a platform to those providers and saying, look, I'm here, I've been practicing for a while, I can't, your insurance isn't going to pay for me. But if all of a sudden you ditch insurance and you don't have to pay $2,000 a month for your family's premiums, and you could spend $2,000 a month on actual care and
food,
being more proactive instead of, worst case scenario, that money that is already going towards health. Americans are spending more on health insurance than they are on food. I mean, it's gotten so crazy to the point where, we've removed the health from that healthcare, perspective, and it's really just a sick care system.
Yeah, actually, before we get into the business side of things, I do want to talk a bit about health and lifestyle. So, out of curiosity, how is the nomad life like? Personally, that's what I'm aspiring to do eventually. So, who is the nomad life for? What are the pros and cons of that?
Yeah, I think it's amazing. My wife and I were nomadic for a couple of years during the pandemic, traveling around to many countries and around the U.S. And now that we've added a baby, it adds a bit to the mix, but it's super fun because we can, it's very much, I feel like the sovereign individual thesis playing out of go where you're treated best. And you can kind of even arbitrage nature or weather in a way where, in the winter you can go down. We've done this down in Argentina and Uruguay, or South Africa, or even where we're heading this winter to Costa Rica, and be able to get sunlight and get in the ocean, touch the sand, get high quality food. But community is also really important. And going back to Austin, where we've been the last couple of years, we were able to spend some time there this fall. Now we're with family in Chicago as well. So it's kind of that flexibility and freedom where, we put our stuff in storage and just kind of, you realize you have a lot more stuff than maybe even need, or here's what we need to really live day to day. And if we have access to the internet and our computers, we can continue to work. And so I think it's kind of like the longer approach of, what are your goals? Where do you want to experience? What type of culture do you want to put yourself into and learn from? Very much in Costa Rica, people are slowing down. They're connected to the sun. Everyone goes out to the beach for sunset. And it's tough when you're up north and it's dark and depressing and 4:00 in the afternoon and you're getting out of work. And I experienced that myself, and working in these traditional healthcare jobs for a few years out of college and in Chicago, it's really hard. And so to try to create that, that vision where if you do want to make that a lifestyle, it's possible. It's definitely, you can put in the work and try to kind of scout and say, hey, where do we want to be when, and really be able to settle into different places too, where it's not just every, 2 or 3 days you're moving somewhere, but you can settle in for a week or a couple of months and still build community, meet people, make connections, and learn, right? I think that's the best part about traveling in the nomadic life, is you don't get stuck in kind of the day-to-day or driving the same streets and eating the same foods. And you can really try the local food, whether that's fruit and vegetables, or you're connecting and finding where's that local rancher, where's my raw milk hookup. Here in Costa Rica or in Austin or in Illinois, it's a little harder. So you realize there are a lot of differences, in places. And so thinking about, and one of the best things about Bitcoin is traveling and meeting Bitcoiners wherever I go. So I love that component too, whether it's, using Orange Pill app or just looking on Nostr and Twitter or X and just seeing, okay, where are the Bitcoiners? Or there's some meetups? Are there people I can connect with? And as Bitcoin continues to grow, and Nostr does as well, you're able to find people that, kind of see the world in a similar way, or like-minded and striving towards improving themselves, their family's life, their situation. And for me, that push to work in Bitcoin or on Bitcoin in some way was really strong, and just wanting to find a way to add value and make that work, from my experience in healthcare, but then that self-learning and discovery that has become, the resources in Bitcoin just continue to grow. But an individual needs to choose to learn and kind of dial in and not just tune it out. And you definitely see that, I think, a lot now. And with all-time highs, it's turning heads again. But it's like we've been talking about this for years, right? And so it's I highly recommend it. So maybe you pick out a period of time that you want to travel with your family, or where you want to go. Happy to give some recs. It's doable. And I think testing it out now with one, I'm sure it gets harder with more kids too, but it's an adventure and creates a lot of excitement.
Yeah, I got 3 children, but I'm still more than motivated to try it out. I think it also opens your mind to see how the people are around you. We're not all that different. I mean, there of course are differences, but in the end, we're all human. You also mentioned you're a yogi instructor, so I know, and I have to ask because this is at the end of the day also a carnivore podcast. Have you ever tried the carnivore diet? Because I know most yogis are into vegetarianism and veganism and things like that. I know because my mom was also looking into that stuff some time ago.
Yeah, I have tried carnivore. I did it for a couple months this year and felt great. And think I'll give it another go kind of as we head into winter for a little bit here, and focusing more on just, I always like to eat animal based, but it's easier. There's events or weddings and things, and it's like, okay, I'm gonna
Yeah.
eat some other food that is fun, but at the same time, that has been a challenge. I think in the yoga world, even my yoga teacher training, which was 3 weeks, they're serving us meals three times a day. This was in Bali, and there's no meat, and so I had to leave a couple times to go to go get some meat. Or at least now I can bring around some beef sticks or alpha bars or whatever it is to have that nutrient density at the ready. But yeah, I think it's in, playing with tinkering with the diet, understanding how you feel, and I definitely felt great. On an animal-based diet, it can be a little harder when I'm traveling and I can't have that stock of beef that I'd like to have, in the freezer. And being in Austin with local pastures there, Shorttail Creek, and you've got Holy Cow nearby. Shipping, we're a little bit spoiled with all the options. But I think more and more, even yogis or others out there realizing, okay, it's the ultra processed food. It's the 60% of food that's, ultra processed. So if you are going to go vegan or going to eat differently, at least if you can focus on the whole foods or real food, there are other things you can eat. But to me, there's no substitute to beef and meat. And it's just the best food. And for our daughter's 1-year-old birthday, give her a little birthday steak, a little ribeye.
Nice.
She's been eating that from an early days, and marrow and liver and sardines and salmon and beef, and it's just, I think naturally the body, that's what it craves, that's what it wants, and it has the most nutrients within it, and we're not able to process the carbs and starches, especially at a very young age, really well, and even as we age too. So definitely done self-discovery along those lines, but as you said, everybody is different. And that's where kind of playing with your own inputs and then how you feel on the output side is super important.
Yep, definitely. I'd say everyone has to experiment for themselves. Everybody tolerates certain substances more than others. But at the end of the day, whatever is the closest to 100% carnivore is usually around the best. I personally don't do 100%. I do like a 90, 95%, the rest being mainly dairy and some very, very occasional fruits and vegetables. But I have a 9-month-old baby, and he's eating only meat right now. So
Amazing.
He just devours that completely. And before we get into the business side of the chat, one last like a personal one, like how does having children? Because you mentioned you have a daughter, right? How does having children change a man? Personally, when I had my first child, I think it helped me mature at levels that I like never before. And I think having a child really gets a man maturing quicker than I think he would otherwise do.
Yeah, absolutely. I think it forces you to, fully grow up and you're responsible for another human than just yourself. And I'm fortunate that my wife is amazing, has been breastfeeding, and can do a lot of things that I can't. So just finding ways that I can contribute, whether it's changing diapers, getting up and supporting, taking care of her in the morning, going for walks, getting her outside, carrying her all around. In Costa Rica, where we were by the beach, not so many paved roads. So it was just in the backpack for a walk every day, putting the feet in the water. And so, yeah, it's just naturally moving your body more. And I think that's even more important I think your body adjusts too. I mean, not sleeping for more than 3 or 4 hours in a row for about 6 months is rough.
Wow.
But, the body adjusts, and she learns, more and more how to sleep and stay down, longer at night. So you just have to adapt and be a team, I think is a huge one, but it's definitely changed me in my perspective. And I've always thought I was pretty low time preference, but now I'm like really low time preference and trying to think of, down the road and thinking, studying more about on the education, kind of alternative schooling side of things. There's a lot out there, and Bitcoiners already doing great work. So just continuing to learn. And that was even a big process too, learning about the birthing process. We went to a birthing center. So it was outside the hospital. And I think it's important to know what's going to happen, or at least what are the potentials of happening. You never know, of course, what's going to happen, but being confident in the body and nature doing its thing, and trying to stay away from a lot of the medical interventions that can lead towards worse outcomes in a lot of ways, I think has been important for us. And yeah, it's quite the journey, and grateful that every day, and it's so fun. And I'm sure and with your kids, it's just like that's the best time of the day whenever we're spending it together. So we've just got to be flexible on work. My wife's an entrepreneur as well; she owns her own business, so we have a lot of flexibility, and just have to, I think, communicate and be really attentive of what your baby needs. They can't communicate at all, but they can get the cries out and see, okay, maybe I'd rather be eating beef or eggs than these raspberries. I don't know.
Yeah. I think the next 10 years are going to be great for Bitcoiners to have children. I think it's going to be like a fantastic, like prosperity is going to come. Like if you're a Bitcoiner, especially for some time now, making babies right now would probably be a great idea. We need more freedom-minded people in this world, and I think the ethos of Bitcoin provides just that. And like Jon just said, like having a child just makes you mature. You can see longer term. You think longer term, and I think the children of Bitcoiners are going to be one of the most prosperous generations the world has ever seen. And let's keep on making babies.
I love that. I love that. And got to keep making more Bitcoin babies.
Definitely. And finally, going into the business side of things. So you mentioned Satoshi Health Advisors. What's the average age of your typical client, more or less? And do they come to you, or do you look for clients? What's the dynamic there?
Yeah, a little bit of mix of both. I'd say my clients do tend to be more even on the boomer side, or like kind of Gen X, that have started going down the Bitcoin rabbit hole, or at least have a business model that aligns a lot with the values of Bitcoin. Maybe they've been running their practice for even 10, 20, 30 years and have adopted previous technology before, whether it's telemedicine. One of my clients, Dr. Roger down in San Antonio at Direct Med Clinic, he was one of the first doctors at Teladoc, 20 years ago, saw the future of telemedicine. Similarly, now with Bitcoin, that was more from even an outreach. There's a group, Free Market Medical Association here in the U.S. That I'm a part of, and connected with other freedom-minded providers. Others just from meeting through Austin Bitcoin Club and podcasts, and kind of being out there and just talking about healthcare and Bitcoin. I've found some amazing clients to work with that need some support on the tech side, or see that, hey, there's a lot of options out there. So do I want to integrate with Strike's Shopify plugin, or do I want to use Zapperite? How am I going to save with my business compared to my personal? With a company like an Unchained, or go on a River account. There's a lot of pros and cons, or at least trade-offs in the Bitcoin ecosystem. There's so many great tools out there, and that's one of the benefits I think of kind of being a Bitcoin consultant and coming at it from the healthcare industry, but knowing that there are a lot of choices that a business can make strategically in how they incorporate Bitcoin. I think having someone to talk to, like myself or others that I'm seeing out there now that are doing this type of work to help a business evaluate the right tech stack and the right model depending on who's owning the business. So most of the businesses I've been working with are smaller or family owned, businesses. Maybe there's one or two decision makers, or there's one decision maker that wants to get the other one on board, and kind of having someone more objective, or at least come in and tell the story on what is money and here's why fiat's broken. Here's how Bitcoin and Lightning work. It's for us that have been reading and listening, it might seem obvious, but for someone else that's coming from a legacy like fiat healthcare industry, even just having it explained or talked about for a couple hours could save hundreds or thousands of hours of reading. And doctors are busy. There's a lot of other research and things you can read that will also benefit your patients. And so if what my conclusion is that Bitcoin is the answer and a tool that can now help smaller independent businesses remain independent and continue to grow and serve their clients and patients in a way that really is the reason why they got into medicine in the first place. I think it can resist a lot of the, a lot of the burnout and challenges that you see with providers. I know in the U.S., and I'm curious to hear if that's kind of a similar phenomenon that you're seeing in Mexico with the government healthcare system. So, yeah, it's been a great mix, and always welcome new modalities, whether it's chiropractors or even helping my yoga teacher back in Bali start accepting Bitcoin, and even
Cool.
I think seeing ways where, look, this is a global payment network that anybody can opt into, and it's way more efficient than Wise or PayPal. And there's we're out of the country, I can't just Zelle you or Venmo you that we're so used to doing here in the US. So whenever I'm traveling as well, even in Costa Rica, I'm saying, okay, these are maybe some business owners that would definitely benefit from adopting Bitcoin. And depending on the country you are, there's a lot of differences too. Like they have an amazing stack down there where, wouldn't even necessarily be a full project with me. I would just say, hey, connect with Bitcoin Jungle. They have their own BTC Pay server instance. And with Bull Bitcoin, you can go back and forth between Colonis and Lightning. And it's just kind of a matter of like making those connections and asking questions and hearing what are the pain points in the businesses today. And I think the business owners, especially the ones that I've met from places like Argentina or even Zimbabwe, where the money, they've experienced broken money firsthand and what that hyperinflation can do, they're that much more receptive to, oh yeah, this could be cool to accept Bitcoin. But then of course you need Bitcoiners out there willing to spend their Bitcoin, or at least using a service like Strike where you can convert your fiat into Bitcoin at the point of sale. So there's so many tools and options, but I definitely subscribe to Parker Lewis's theory on pay me in Bitcoin, and very much merchant adoption and leading the way, and that it's individual business owners making those decisions and incentivizing, thinking of creating creative ways to get your patients or clients, or customers interested in Bitcoin, whether that's a simple discount or a fiat premium or plugging in Oshi rewards or whatever you want to do to say, oh, I can get more value or pay less if I'm spending Bitcoin or using another service. That will get more people curious and interested. And even Dr. Wilson, who I worked with, is a dentist in Michigan. He's accepting Bitcoin and Lightning alongside fiat. And even though he's still mostly, if you're getting mostly credit card payments, every time people are checking out and paying, they're seeing that word Bitcoin, they're seeing Lightning. And I would imagine as it continues, Bitcoin enters into the mainstream consciousness again, and over the next few months, particularly with the strategic Bitcoin reserve, bill and what the U.S. is going to do, the game theory really kicks off at the nation state level, at the business level, at the individual and personal level. And so I think the more businesses where I'm getting something valuable, and we have this value for value exchange, more of them that are accepting Bitcoin sooner rather than later, the more seamless things will be as fiat currencies continue to fail, because that's just the history of fiat money. When it's not backed by anything sound, every single fiat currency in history has gone to zero. Right? It's just a matter of time. And so, we're not rooting for that to happen tomorrow. I think there'd be some chaos, but and we definitely don't want that. So that's where the education piece comes in, and kind of the core of what I'm trying to provide with Satoshi Health Advisors. I've done a couple master classes that are free online. You can watch them, and going through, really understanding what's broken in healthcare. Here's why I think Bitcoin can be a solution and support more of a decentralized healthcare system. But it's going to take time. Healthcare, as you know, is traditionally very slow to adopt new technologies. And it's really the change management piece. And there's so many, players involved in healthcare interactions, and things can come up all the time. And it's hard to know what is the root cause? What's the issue here? Are we just going to throw another pill or surgery at this? Or are we going to look at more, lifestyle and diet, and nutrition, and more holistic approach to getting what are all the inputs that I need to understand, and levers that I can pull myself before even doing anything external to my own body.
So, yeah, the what you mentioned, all of this is the Satoshi Health. So, correct me if I'm wrong, it's basically you help any type of business or individual adopt Bitcoin as a part of their pay model, and you tell them what's perhaps best for their situation in particular. It's at an international level, and also this way is however you set them up. I guess if you use like ZapRight, for example, where you have the option for the patient or client to pay in either a Bitcoin or a fiat. I think that's a way to orange pill people, get them curious. I do have a question regarding the premium versus charging offering a discount. Which method do you think is better? Like charging a premium for paying in fiat, or offering a discount if you pay in Bitcoin? Which one do you think is best?
I like the fiat premium model. I think when you offer a price, and and I get this question all the time, but of course we're still using the dollar as the unit of account, right? Even companies that accept Bitcoin are not necessarily fully on a Bitcoin standard yet from that perspective. So it's saying, hey, this is my price. If you pay me in Bitcoin, that's kind of the bear. And then if you pay me in fiat, that credit card percent could be 3%. It could be 5%. In healthcare, it's often over 6 to 10% or more of every transaction is going to a middleman, whether that's a payment processor, EMR, billing, electronic medical record billing company, in claims processing. That's all those middlemen when dealing with insurance payments in particular. So I think if you're saying, okay, it's a 10% fiat premium, some of that accounts for that 3% that now I'm not getting if you pay me in credit card. And then the rest of it is trying to push and really incentivize and say, oh, wow, I could save now 10% if I'm paying this person in Bitcoin. And I have seen more of my clients paying me in Bitcoin, which is awesome. And that's what I prefer, because now, the work I delivered a month or 3 months ago is 30, 40, 50% more valuable, right? And so it's the most efficient way to get Bitcoin versus having to get fiat and convert it into an exchange. And so I think that for every business owner, they can make that decision, but it's not like, oh, it's a favor if you're paying me in Bitcoin and therefore I'll discount it to you. It's more of, hey, I'd prefer you to pay me in Bitcoin. This is that price. That's what I know I need to run my business. And then, it's more of a convenience fee for you, and saying, yeah, you still can pay with a credit card if you want. But I prefer you to pay, in Bitcoin here. So rewards is another one, an incentive, like another way to just give sats back. Like my e-bike client, Mod Bikes, they were doing 2% back for people that pay in Bitcoin, rather than, so basically in rewards. So there's a lot of ways to do it, and it depends on how you're accepting payments, who's involved, how you want that customer experience to go, because Bitcoin customer experiences and UX, UI needs to, continues to improve, and it needs to be as easy as, what people are used to with Apple Pay and
Yeah.
tap to pay here, because that's the convenience factor is definitely huge. And even I was seeing that in Costa Rica and in places I was going, they've got terminals, they're accepting credit card, but I'm sure that those fees are pretty significant. So that's why I prefer, and whenever I go to a restaurant or to the gym, in Santa Teresa is one town where there was a good amount of Bitcoin activity. I'm going to pay them in Bitcoin, even if there's not a discount or premium, because I know that business owner is going to get more value than the credit card company taking a cut. So that's a decision for every business owner to make. And that's where the fun creativity part, and then telling the story, marketing it, getting out there and just having that message. So even if it's 5% discount that you want to give from your monthly membership, great. Let's start there. If you want to give it more thought and kind of really tease it out, you can, but everyone can kind of pick what works best for them in their process.
All right. For those interested, I'm going to leave in the description links to Satoshi Health Advisor's website, so you guys can check it out, make your business grow. I guess save a lot of time learning about Bitcoin and how to integrate it into your business. Time is money, and money is Bitcoin. So, and it's blowing up right now. A great bull run. It's my first bull run. Can't wait to see how high it goes. So let's go to Nostr Fabrica now. So I heard in a podcast once that United States has every other socialist healthcare model in it. Like you have Obamacare, you have Medicaid, you got like the whole different model. You got like Canadian model, you got the German model, you got the Scandinavian model. Is that true? More or less?
It's definitely a blended system for sure. And you have the government playing a big part for the elderly and the disabled with Medicare, so 65 plus, and then Medicaid for low income. But between the two of them, that's over a third of Americans, that are on either one of those plans. 80 million on Medicaid, 10,000 individuals aging into Medicare, 65 plus, that silver tsunami, every day. So wow. There's more and more that the government is having to take on from a payer perspective. And then about half the country is covered from their employer. And this was really a legacy of World War II, wage freezes and being another benefit companies could provide. And so you have this employment tied to health insurance, and those employers are actually paying, and then individuals on insurance plans, commercial plans, are paying 250% more for the exact same service than the government pays. So there's a huge differentiation in pricing that the health systems offer, and through their negotiations with all the various insurance plans. And then you do have about 15 to 20 million Americans on Obamacare marketplace plans that are heavily subsidized still to this day. So it's a big tax expense to even have those markets sort of work. It's still very expensive for premiums for an individual. And then you've got another 25 or 30 million Americans that are uninsured. And so I've been delightfully uninsured in our family for 2.5 years now since joining Crowd Health. And there are other options out there, right? And now going direct to your provider, getting a fair price, having the support of the crowd for any bills over $500. I think it's a great model, and hope it continues to grow. And I joined in working in Crowd Health. There was around 1,500 members. Now it's about I think it's somewhere in the 7,000-8,000 range. So wow. It's definitely growing, but still a drop in the bucket compared, of course, to these bigger plans and healthcare system in the U.S. So that's more the private pay side, right? You have self-pay, you have tax funded, you have state level plans. So each Medicaid plan is actually, while it's paid for by the federal government, is run and operated by the states. So you have very different structures and benefit packages and plans and options within each state. So yeah, it definitely has many of the healthcare systems rolled up into one. But then with this dynamic of the providers need or are differentiating based on, who's paying them in a lot of ways. In certain aspects, they can't fully discriminate, right? And like if you show up in the emergency room, there's EMTALA, which is a law in the 80s that said, if you show up here, we have to provide you care no matter what, regardless of your insurance status. But then that's where you can actually get stuck with a much bigger bill if you are insured, because if your emergency doc or anesthesiologist was actually contracted by the hospital and you thought that hospital was in network, but it was actually out of network, you're stuck with that contracted price. There's nothing you can do about it. Versus if you're uninsured, you're going to negotiate that after the fact and you're going to get a fair price, because hospitals are only getting 9% of all the debt that they're chasing. So the provider would rather you be self-pay, because it takes 2 to 3 months for the insurance company to pay them. And that's where, Bitcoin is, of course, this instant settlement tool, with the Lightning Network in particular, or with Bitcoin in an hour, right? You use 6 blocks. Compare that to 2 to 3 months settlement time. It's not even close. The way that you can speed up this, the revenue cycle management, which is a huge part of any health system and providers' role in the U.S., because you're generally collecting a lot of money well after you render the service. So it's difficult to balance those two. And then typically on the data side, you have bigger centralized companies that control your data and is often hacked. United Healthcare earlier this year, their Change Healthcare got hacked. 4 years of work, 1 million lines of code stolen. Wow. They process over $1 trillion a year. So they owed still tens of billions of dollars to providers that was not getting paid out, in a prompt way. And then they were even buying out some of those providers that were now cash strapped because they weren't paying their claims. So it's really unfortunate to see that. And I think with Nostr, we're trying to, and you can chat more about, that's Avi's personal experience too, and work experience now, being at that United team. So he can speak to that. But, I think the question is, do Americans actually care that likely their health data has been hacked already, or is being shared and sold off without their consent? We're out there and seeing in the Bitcoin and Nostr landscape that we think people will care. And if presented, provided an alternative opportunity to store their own records where they have their keys using Nostr in an encrypted way. And of course you have eventually care discovery in this communication aspect, but at its core, can I maintain my own health record over time and have certain data points that if I want to work with a doctor on my health, we now have a better way to exchange that information back and forth, or sharing that with a family member or a loved one, or socially for any of the goals that you want to share. Health is very social in that way. And so we think that with Nostr, there's an opportunity on the healthcare data side that can help kind of turn the incentives around in those healthcare interactions. So instead of all these other bigger players that I'm describing, whether that's big pharma or the big health systems or the government or insurance companies, they're all giving your data back and forth so they can take care of you, instead of the other way around, where it's your data, you're the driver's seat, you can go and get the value from any of these services you may or may not need. And we have a much more efficient way and secure way of doing that. And so we like this concept of, even individuals having their own relay, right? So you can have your own relay that doctors can even write onto, you can write onto, you can manage for yourself or others, or we can host that, for you, sort of model here, and showing what's possible in what do I need to track? From your perspective too, what do you need to track as a doctor to know if your intervention or kind of your program has been successful? If you are shifting to carnivore diet, what are the things that you need to track and data that you need back in that feedback loop from the patient to know if this course is working for them?
There's just so much, it's like Wild West right now. So there's so many things that can be implemented to improve the current centralized system. And you mentioned earlier, these healthcare providers or institutions are transmitting information between themselves, with you out of the picture. Nostr seems to solve that because you become the owner of your own information. But I would also argue that the communication between these health institutions is actually inefficient in itself. As you mentioned earlier, if different chain of hospitals, or in Mexico, like between different healthcare institutions, like there is very poor communication, and I think that's also another huge problem. Like, not only are you not only the owner of your own data, if you want to go to a different hospital, and good luck, right? So it's also highly inefficient. So it's pretty cool that you guys are taking this step into decentralizing basically your own health data. And correct me if I'm wrong. Like, basically, I could get healthcare in the United States and then perhaps be in India one day. And if this healthcare provider is on Nostr using like a relay, he or she could, in theory, get access to your health data if you want it to be so.
Yeah,
Yeah,
yeah, absolutely. And we've been collaborating with the Illuminodes team in El Salvador, and they were looking at also using Nostr for healthcare and piloting with a hospital down there. And so just even aligning on, hey, what are the open source standards that we want to use? And Vitor had already been working on this NIP82 for medical data, which is basically a way to wrap FHIR healthcare data, which FHIR is international standard for expressing data in a whole host of different ways, fast healthcare interoperability resources. So you can kind of see here's all the ways we can express it, but now let's just wrap that in a Nostr event. And so now we have it on Nostr in an encrypted way. And let's use this as a sort of this open source standard that anybody can build on. So even coming to that, and we love more developers that are interested in healthcare, interested in Nostr and Bitcoin, to want to build on this open source standard, because we see, Fabrica is our factory. So we want to build many different healthcare applications, and we know we can't build them all ourselves. And we want to have a healthcare ecosystem where we can do exactly what you described, whether you show up in India or you show up in El Salvador and something happens while you're traveling and you need to share some vital health information with that provider. Well, now we can already be on the same standard. And even you have that yourself that you can share, and then an easy way to transfer that data, in the time of need. So I think aligning on, we're still very early days, but we have a good sense of what some of the initial open source protocol is going to look like. And I think that will continue to evolve and grow over time with other end event kinds, and to express other types of data, whether that's X-ray images or other lab data, or even, heavier types of data that Nostr has typically had, more lighter notes. So I think we'll explore that other stuff side when it comes to health and getting more health data onto Nostr. But it all has to happen through, I think, trial and error, through iteration, through these different use cases. There's so many challenges in health. And so we're trying to figure out now, and I'm going to be conducting some kind of product discovery interviews. So if anyone's interested, definitely reach out. Would love to chat further, and just understanding, what are the biggest challenges that you face as an individual managing and optimizing your own health, some of the difficulties in accessing care or paying for care, and exploring that problem space even further to say, where can I or how can we build tools that will solve real problems that individuals are facing, and complement very, very much so, because in the US we're already on electronic medical records. So shifting from one electronic system to another is actually, I would say, more difficult than going from manual or paper records onto electronic the first time. And so we see these leapfrogs in technology often. I think in El Salvador, where they're starting with the hospital, that's amazing, because they can really be in there with the administration, building the tools, going from manual to Nostr and in the Salud protocol, right? This open source protocol for health. Whereas we would rather start more on the individual level or the outpatient side, more outside of like the legacy healthcare system, to be able to test out different tools and solutions, because we already have a kind of a cluster when it comes to healthcare data interoperability in the US. And then testing these tools as well, with doctors like you in Mexico, or with Dr. Allen, we have a laser eyes tool that we'll be sharing more on, that's built on eye prescriptions for glasses and contacts, and being able to get that prescription, hold it in your hand, show it to the eyeglasses store. All they need is a signed note from the doctor, And this is a perfectly signed note. It's a cryptographically signed note from the doctor, right? That this is your health data, or this is what I need for glasses or contacts, and you apply that to all different use cases and needs in the healthcare side. We're excited to learn more about what are those challenges for people that are on their healthcare journey and are finding doctors like you to want to get at the root cause of why they're not feeling good. So if it's just tracking your metabolic health metrics, or that the glucose, A1C, even other things we could do at home, like your waist circumference, or any other measures of metabolic health that we know are, if we can track that in a better place over time, and also don't want to necessarily give all of our data to Apple or the other big boys, right? Because that's another piece of this. Of course, there's a whole explosion of wearables and data that's out there, but it's very much, I think, information overload in a lot of ways. So how do we pick out, what we really need? But if you also care about sovereignty and privacy, you probably don't want to give all that very sensitive health information over to the big boys. And that's just being fed, into the AI algorithms and whatnot. So we envision down the road where if you now have this record of your data and you have certain tags, if you have third parties that want to come in and do drug discovery or do clinical trials and say, I need to talk to someone with diabetes in a certain area, we're testing something out, they could go to you directly and pay you either for your data or for your participation in a study. And it actually solves a lot of challenges that those types of players in the health industry are facing when it comes to, really studying and taking a scientific approach, doing double-blinded studies, placebo trials, the gold standard in healthcare. And I think we've gotten away from that in a lot of the ways, and certainly interests that are, who's paying for the study? You got to, ask yourself that question first before reading any of these studies. But there's so many areas unexplored in health. And I think with Make America Healthy Again, and with RFK and Trump, coming in now, and just an openness to exploring other modalities and aspects of health or healing that have been completely boxed out from that scientific community and academic community, just poses a huge opportunity if we can operate in a way where individuals are owners of their own data. They can decide what they want to participate in and how they want their data to be shared, and enable and turn around all the challenges that we're seeing in our health right now. And whether that's taking care of your child or a parent that's sick or another loved one, that's also a huge challenge, I think, in healthcare. And having a place you're running someone around to different visits and scan and images or surgery, and certain doctors need to know different information, and they're trying to call the other provider. Well, what if you just had, this rolling record yourself, and you can just share that, and you can get more timely care. And, a lot of the technical side we'll continue to work on from a key management perspective, and being able to share data and where does it persist and so on the Nostr side. But that's where, I'm excited, and of course working with Vitor, who's built Amethyst and has a long background in healthcare. He's excited to be building more tools for Nostr for health as well. So we're definitely open to many ideas and this micro app concept as well to get started and just showing what's possible with Nostr for health.
Yeah, actually, meaning to ask, where can people get in contact with your team? Whether they be people like patients or healthcare providers?
Yeah, I think all the above. We have nostfabrica.com, and there's a link there if you want to book a call with me and learn more, find ways to collaborate. Send us a note on Nostr. You can find us there, and love to hear about how you would want to use healthcare data tools in a sovereign way, using Nostr, paying in Bitcoin over the Lightning Network. And getting involved, because I think our approach is going to be very different than the big players out there that benefit from creating, bigger and bigger walled gardens where they own the data, or creating even software tools that are pretty cumbersome to use. We're going to take a very different approach to that. And so understanding the design component and how people want to interact with different apps, whether they're on their phone or on the web, and tools for providers, because the screens for the doctor can look different than the screens for the patient. But the beauty is we all have this underlying open source protocol to express that information. And so I think the sky's the limit, and we'd love to hear from providers that are facing challenges in their own practice or having accountability from their patients and being able to track different lab data or metrics and saying, hey, can we spin up a micro app here? And from individuals, understanding, where can I put this data? How can I do this? What are the biggest pain points that you're facing today in a more holistic approach to your health too? Because I think ultimately, like, what's the goal here is if you have more information and the right information and data on yourself over a long enough period of time, and you have an understanding of what your lifestyle, what your inputs are, and how you're feeling, you'll be able to make changes and test things out. Because that's been, at least for me, the best way that I've worked on my health, and it's just continuing to test and iterate. And I've run a couple marathons in the last couple of years, and practicing yoga and doing breath work and finding, there are a lot of ways to heal and feel good. And it's a matter of finding what is the best movement for you, what's the best inputs from a food perspective for you, how do you get more sunlight, how do you avoid blue light, all the things that, and rabbit holes that we know are out there that you can go down and are just being explored for the first time. If we can maintain that record over time, and where for many of us, our records were probably written down on paper, maybe our parents saved them, maybe they didn't, or oftentimes in the hospital here, after 7 years, it gets deleted. Mm-hmm. And you want to discover, how was I treated as a kid for this chronic condition that I'm still dealing with, whether it's type 1 diabetes or Crohn's or some other inflammatory disease. And you want to go back and really study and understand yourself and your history. You can't do that now. And that's unfortunate. Whereas what we see in the future is if we can start building this architecture for patient relays and for individuals to have, HIPAA compliant data that they can interact with, at least from a U.S. perspective, that's, regulation here in the U.S., but there's going to be different regulatory considerations in different countries that we're operating in. So that's going we're going to be mindful of that. So there might also be better places to start than the U.S. And that's where maybe even let's test some things out, in Mexico, and let's see like what would be, beneficial for you in your practice and all the stories, and that human behavior element so well. How can we design a tool where people get excited about tracking these different metrics and then taking where we're heading, which is ultimately personal responsibility for your health, better health outcomes, and just living, your best life that can happen when you're healthy. And you're not going to be able to enjoy your Bitcoin unless you're healthy. And that's, I think, at the end of the day, a message we hear, often and from the elderly. And so being able to have extend your health span and utilize the new technology and tools and wearables that we have, but in a more kind of sovereign data fashion, where you're not going to get that in the legacy or at least fiat healthcare system. Now is where we're going to differentiate ourselves and find those users, find people that want to test it out, be using new tools and letting us know, hey, is this working? Is this not? And is this going to be a valuable service or product, that I can use in my life, whether it's a doctor or provider. So I'd love to spin that back on its head a little and hear from you too. Like, how are you, as you're digesting this and have thought a little bit in our discussions on Nostr and healthcare, and how you've already been a leader in getting onto Nostr and having it be a platform for you socially to spread the word on the great work you're doing. What do you think are some of the potentials here, or what you would want to see for any tools with Nostr and healthcare?
Well, we've been talking back and forth about that. I think one of the most basic tools that I mentioned it. It's tracking glucose, and for those who have hypertension, like tracking their values over the period of a few days. And because especially in elderly patients who aren't very tech savvy, they just take pictures of the monitors, or and then I got to get all this information and pile it up in certain files, and it can get a bit hectic, a bit messy. And I think that's a very simple tool that could be developed, and I think that'd be awesome because as a doctor who focuses on telemedicine as well for these metabolic consultancies, actually a lot of my patients are Latinos living in the United States. So it'd be pretty cool to have like this certain application where they can. I just send them a link. I don't know how it would work, to be honest. I guess I send them some link, and then they just start putting in the inputs, and I receive it to my relay or something like that, and I can see everyone's individual progress. That would be amazing. It would simplify. It would streamline the process, and that's a cool thing. That's what I can think of right now. I guess with time, I'll be seeing what other things can be implemented. But I think
Awesome.
saving time and being more efficient with work definitely helps
Mhm.
make these type of alternative medical things more attractive, more easier for both the provider and the patient. I'm curious, like how did you get the dream team together? You know, Vitor, Avibur, and yourself. How did it all happen?
Yeah, I mean, it's pretty organic. I'd met Avi through another Bitcoiner in Nashville, in Miami, like a year and a half ago, since we were both working in healthcare and interested in Bitcoin. And then I was doing some Googling really and looking up Nostr and health, and had seen the writing that Vitor and the team at a nonprofit that's called PathCheck was putting together, trying to use Nostr for health for street medicine, and just reached out, and we started having conversations this year, and brought Avi in the fold, and saying, we can have the product experience, the tech experience, and then business strategy and operations, and coming together and saying, hey, can we, is there a there? And we just started ideating and collaborating and said, hey, let's do this. Let's launch a company and see what can happen in this intersection of Nostr, Bitcoin, and health. So it's been pretty organic this year, and meeting, and we're spread out. So we're a remote team, but got all together in Nashville this summer. And, I think there's going to be a lot of opportunities and ways that we can, kind of divide and conquer too. And whether it's, Avi was speaking out in Nostr Valley in Pennsylvania. Vitor was over at the HRF event, in Nashville. I'll be traveling a bit. We'll definitely trying to get down to the Bitcoin Freedom Festival while I'm there in Costa Rica.
Cool.
Yeah, grateful to be working with those guys. And I think we'll see as we grow organically who wants to get involved in this movement of Bitcoin, Nostr, and health. And of course, a lot of the tools that are being built so far from a social media, perspective on Nostr, but not everybody. And even right now at 40,000 weekly active users, I think it's been a pretty good success of bootstrapping an open source network. And so we want to create that network effect where maybe there are people out there that don't care or realize, hey, social media, Instagram, Facebook previously haven't been good for my mental health. And so I don't use social media. So therefore I don't want to use Nostr. And then they say, oh, well, I can actually manage my health data using Nostr. Maybe they don't even really need to know it's Nostr, but it's a better way and a more private way to getting more users, onto Nostr. And then they can go and see, oh, I can do value for value with podcasts or music, or just find more aligned content instead of being fed, the algorithm and more fear, hate that, we tend to see on some of the other platforms, and where you own your data and the protocol level is separate from the application level. So I think we're optimistic that there will be people out there that we know are using this pretty busy health app ecosystem. And that might be a way for them to share their goals. And I think having that accountability and having community is super important when it comes to health too, because you might want to learn and discover what worked for somebody else, reading the case studies and the anecdotes. Of course, everybody's different, but when you can learn from other people's stories, which I think you've teased out really well in your podcast, and in listening to Sean Baker, Dr. Sean, and I've met him before as well. And
Cool.
knowing that there are so many ways to heal, and there are great tools like going on a carnivore diet, but finding the doctor that's going to be able to work with you, get to that root cause. I think Nostr can be a great platform for those types of providers that want to grow their business more in a telemedicine fashion, just as you've been doing. Because a lot of healthcare too isn't necessarily, if you're not prescribing drugs and you're having a chat, that's coaching, right? That's not
Yep.
healthcare. Of course, it's a little bit, that you need to be very mindful of where you're providing care and what is, but in their definitions for these things, but in very much, as you said, we are all human, and learning from other human stories, talking to another person over Zoom and getting that consult or just talking to someone, you can learn a lot, even if you're not getting a medical, it's not actually a medical visit. You're not getting prescribed a drug. And I think that's where people can see, oh, I have tools to connect and communicate and find doctors. We think Nostr can be a way for that discoverability and locate people who are naturopathic doctors or other new German medicine or other alternative healers that might even be getting boxed out from a lot of the algorithms with what they're sharing on Instagram. And
Yeah.
they're realizing, oh wow, my whole business is based on Instagram. That's pretty risky to have all my eggs in one basket. Maybe I should start looking at this Nostr thing and start posting here just about what I know. And then all of a sudden you're going to find a community and be able to kind of move more people into the broader Nostr ecosystem. So I think, it feels right. We'll see what human behavior looks like, and the tools need to be great and a better user experience than what people are used to. But I think we can get there over time, and it's a learning process, and we're just starting out. So appreciate having these conversations and connecting with the people that we have so far to learn about what we're building at Nostfabrica.
Yeah, and actually, just like my path to fire commented here on the chat, we're early on Nostr. Like, there's so many use cases for Nostr, not just social media. You're an example of that. Bring healthcare onto it, and we were mentioning telemedicine a lot. Like, do you know if there's any telemedicine Nostr type app out there? Because I think another important feature would be like having an app, like a client just for that. I know some patients would like to record the consultation to look back on it later on. Perhaps even prescribe or use laser eyes, perhaps like integrate that with a certain client. Are those things possible? Do they exist already?
Yeah, definitely. I mean, I'd say that they don't really, they exist to an extent in the legacy, in the fiat healthcare system, right? There's ZocDoc, there's other Find a Doc, tools that you can get connected to telemedicine doctor in your state, Teledoc, for example. But they definitely don't exist from a global perspective, where if someone outside the U.S. is trying to get access to a U.S. doctor, or someone in the U.S. wants to learn about how they're healing in India, in some of those Ayurvedic practices, right? So there's so many ways and modalities out there. So we've talked about, and definitely see a potential for a DMADoc type tool where you have this opportunity to talk directly with the doctor and pay them some sats and start these conversations that you can learn from. But I think, with any marketplace, right, that's a two-sided marketplace, it's definitely a challenge. So can we get the users on there and individuals who need help, want to work on their health, and their providers providing the right type of care. I think there's opportunity there, but it's, certainly an app that I think, could be built on Nostr, and we have our value exchange mechanism. And so much of healthcare, blockchain for healthcare, there was all this hype, a few years ago, especially around 2017 timeframe, 2018. And that's when I was working in a big health insurance company. And you realize that it's the only efficient use of a blockchain is for decentralized money. It's usually much more efficient to have just a centralized server. But the problem with the centralized servers is that you don't own the data, and the company or the third party owns the data. And so maybe, I think Nostr can be the right blend where it is decentralized, but it's not a blockchain, and you can run your own relay, and you don't necessarily have to communicate with put certain data onto every relay. You can put it onto more, healthcare specific relay. And then we unlock the use of Bitcoin for any type of value for value exchange that you're describing here from a telemedicine perspective. And boom, all of a sudden, we can utilize these tools to their fullest extent. And we don't need another token for that, and we don't need another blockchain for that. And I think Nostr, which wasn't around in 2017, and that whole blockchain for healthcare hype, when we saw the peak, of the Bitcoin market at the end of 2017, it's I think Nostr can be a real solution there. And having seen other attempts, and having been in a big health insurance company, when you show up and you're on, you have a employment. Commercial sponsored health insurance with your employer. So you worked at McDonald's, right? They were part of this. They were one of the clients of the company I was working at. So you lost your job at McDonald's and now you're on Medicaid, right? State sponsored healthcare. When you were going to the same Blue Cross plan, you're a completely new person. They had no idea who you were. Your identity, even within the same company, your health history within the same company was not translating into this new, your new status as being on Medicaid. And so if that's happening in one company, right? If that's happening within one company, imagine what's happening, across the whole ecosystem. So that's where Nostr, from an identity perspective, and having your own, NPUB and NSEC and private keys, even separate from the relay part of it, I think can be super valuable, because now you have your identity as an individual, you have your identity as a doctor, and even using Web of Trust and other attestations, you can build that reputation, right? So how do I know you're actually a doctor, or how do I can trust you, or hey, can I read and see some of the other interactions you've had, right? That's where Nostr is public, and you can, so maybe some of these interactions will happen, almost Discord style, more publicly. Others, you want to be more private. You don't want everybody knowing about certain health challenges you're dealing with, of course. And that's where the selective disclosure comes into play, where you get to decide at what level of privacy do you want. And then if in certain use cases you do want to share, or you do want to celebrate with your community that you hit a goal that you had for yourself once taking on a new plan, you can share that. And that's, I think, really where we're driving towards, of having this community of people around you that can support you in making those health changes, instead of being, looking at you like you're crazy because you only want to eat meat. There are a lot of ways to do it, and I've had those looks plenty of times too. So it's definitely an adventure.
Definitely. And everyone who's listening right now and who will listen later on, I will publish this on YouTube later on. I think the world is becoming more decentralized. It's becoming more freedom-minded. Individualism is coming back after, I would say, around 100 years or more of centralization. This means that there are so many opportunities in this current space, both in Bitcoin, Nostr. If you guys are someone with an idea, health related in this case, please get in contact with Jon or Vitor or Avi. I interviewed them both already. They're already on my podcast on Spotify or Fountain, on YouTube as well. Check out what we spoke about Nostr Fabrica. They also talked about a bit about that. Check that out if you guys want to learn more about it. Victor obviously talks to it from more of the programming perspective. And anyways, Jon, is there any place people can find you? Anywhere you want to send them?
Yeah, you can check out satoshihealth.com or nostfabrica.com for the two businesses that I'm running, and I'm at the Bitcoin Yogi on Nostr and X, so feel free to reach out there. And yeah, I'd love to get in touch and chat with you if you're dealing with a health challenge or have ideas and were inspired at all by this conversation to learn more about what tools you would want to see and what you would use. We're definitely in that discovery process right now that I'm really excited about. And yeah, so don't hesitate to reach out. And if you find yourself in Costa Rica this winter, let me know. We'll be down enjoying the sunshine.
Amazing, Jon. Thank you for coming on.
Thanks, Dr. Fernando. Appreciate it.